Hi, I'm Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. Today, I would be discussing about simple or basic OPD procedures in ENT practice. Well, for those of you who have consulted an ENT with a nasal problem, you would have been advised a nasal endoscopy. So when we say nasal endoscopy, it refers to introducing an endoscope through the nasal cavity and visualizing the nasal cavity, the normal anatomy, looking out for any kind of pathological problems. So when do you recommend nasal endoscopy? So nasal endoscopy is generally recommended for patients who present with chronic nasal symptoms. For example, someone who presents with persistent nasal block, someone presenting with persistent nasal bleed, presenting with loss of sense of smell, or persistence of nasal discharge. Now, if it's long-standing, if it's chronic, in these subset of patients, we usually recommend a nasal endoscopy. So this is an office-based procedure, something that is done in the OPD. We anesthetize the nasal cavity and subsequently introduce the endoscope with camera into the nasal cavity. Now, the advantage of this simple procedure is that it helps you to visualize the entire nasal cavity in depth. It helps you to document the findings within the nasal cavity. So you could do it as a video recording, or you could even take snaps, clicks of the findings within the nasal cavity, and subsequently you can discuss the findings with the patients and then accordingly plan your further course of management. Thank you.